Hey everybody, thanks for joining us. We're back on track with our normal sessions. And thanks for adjusting last week, but go ahead and ask whatever you'd like. You can unmute yourself, type in, anything goes.
Go ahead, Sahaja, and then Chris.
Hi there.
Hey.
Nice to see you.
Good to see you.
Okay, so I have a question about the Phoenix technique from the course we did two weekends ago.
Mm-hmm.
I hope it's okay to ask on this.
Yeah. Let me bring it up because I'll have to look at the booklet as well. So hold on. Go ahead, fire away.
I don't know how to put the question out. How do I do this? How do I work with this? I saw that it felt like there was a really a real, like, what should I say? What is the most effective way to work when you have people that you want to clean your cords with without having to do all 8 hours at once?
Yeah, okay, great question. So one of the things, let me see which one it is. Okay, I mean, honestly, you can do it a couple of different ways, but that first step, A, differentiation, where the first step is application is the TheraCords, and then the next one is the protective web, and then going back and forth between that one a couple of times is step 3. I would just do that step A. You know, the way that I kind of set it up to be is like when you're just working with a client or you had some situation, you could just go to that first step and work it. And then all the other things are to be able to like take it deeper or to like problem solve. And so, you know, a lot of classes, everything's built on the previous step and, you know, you're really trying to unwind something a particular way. This one really each segment can stand on its own. It does something in particular, but we set it up so that first one is like kind of a core thing that you do with people. And then when you want to do things deeper, like more involved therapy or advanced therapy, you go into the other steps, but to be like your go-to thing.
Okay, well, that's what I sort of got that sense of that, but I wasn't sure. So, you know, because like there's a list, you know, I don't know. I wasn't the only one making lists of all the people that you want to clean.
Oh, yeah. And, you know, the thing too is, you know, here you have a list of like potentially good people and negative people, but you can also use it even for a spiritual practice, which we'll be exploring, you know, at some point where when you go through and you start cleaning all these things up, when you're cleaning up the cords and the connections, it's a way to evolve your connection to a spiritual teacher, to a deity, to, you know, a particular partner, you know, anything like that. You can deepen the connection by going through and doing this. So at first, you're just unwinding like the negative parts, but later we're going to be doing things where we cultivate specific kinds of connections with different things. So I mean, I'd really practice that first set. And then assemblage point is worked in right after that. Like I think it's step 4, if I remember right. Step 4 and maybe step 6 or step 5 and 6, 4 and 5. That's what it is. That's helping to shift the perceptions as you go through and you unwind everything. It's helping to shift the perceptions that are potentially there because of the contamination from the cord or, you know, whatever was going on. And so, you know, really, you could probably do that whole section A. I mean, you could probably do it in 15 minutes. I mean, it's not like some big involved thing. I mean, obviously, you can do it in 45 minutes and do it more intensely and deeply. But, you know, the idea was just to be able to go through and clean things up as quickly as possible and not have to do a big involved process.
Right. Yeah, because the first time I tried it, I was 2 hours. It just
Right.
to get to the end of that section. Of course, I was listening to you talk at the beginning, but
Yeah.
it's still like, yeah, I'd love to spend 2 hours, but there's a lot of
Yeah, it's
people.
not always practical. And in the session, like when we're doing it in class, I'm talking through the class, I'm talking about little examples and chit-chatting and stuff. Here you can get down to business and you can really kind of fire that off in about 15 minutes.
Great. Okay.
Yeah.
Thank you so much.
You're so welcome. Let me know how that goes.
I will. I will. I have lots of
we've had a couple of people where like they're into the oils, but their partners are not. And they're just like, I don't know. And they ran them through this like first section. I don't even think they did the whole section. They just did the cords and the protective web, maybe inhaling the assemblage point. And their partners said, man, I feel way better. They don't know what it is, but it is that connection. And people at work are stressed out, or family members or friends, or whatever it is. So you just keep that all cleaned out. And then if you have an issue with a person, it's a way to minimize it and disconnect from the issue very, very quickly.
Mm-hmm. Great.
Yeah.
Okay.
Yeah. Enjoy.
Thank you so much. I will. Thank you.
And then go ahead, Chris, then Robert.
Hey, Chris.
Thanks, Sam. Hey, Greg.
How was your trip to Greece? You had a good trip?
Oh, it was wonderful until I took a souvenir home.
Yeah.
Yeah, I was hoping you can tune in to me, Greg, and see if, any oil recommendations.
And you're doing Monarda, and you're doing like what are you doing?
So I'm currently on Inula just to get things out, and then I've been rubbing bronchioles and pulmonary stress support on my chest.
Okay.
Monarda, I when I do remember, I mean, I took it like religiously until it happened, and then I'm taking it like once a day. Should I
that's okay.
More? I think I'm on the upswing.
Yeah, you look like you're on the upswing.
Still a little tightness in the chest,
Okay.
but not like before.
Let's have you, I mean, still you keep using all the same stuff, but let's also have you use a little bit of hyssop, but not so much for the respiratory component, but let's have you use hyssop and put your awareness on your Mingmen.
Hyssop, okay.
Yeah.
Just say inhale.
Just inhale your awareness on the Mingmen. You could even take a few drops and rub it on the Mingmen a couple of times a day. I think the tightness in the chest will diminish by cleaning up the Mingmen.
Oh, wonderful.
Yeah, I think it's, I mean, I don't need to say this, but COVID was really an odd one, not because of like how deadly it was or how sick everybody got and everything. But it didn't behave like normal viruses. Like it did things in the body that's not normal for like a flu, cold and flu kind of things. And the circulatory issues, I think it's really good just to pay attention to those things. I think it's that thing where people are having a hard time catching their breath later, or tightness in the chest, even after all the symptoms have gone away, is at first I was thinking like it's probably like a little bit of constriction or a little bit of what they call scar tissue is just basically like like spasms, but in the connective tissue. So it's not scars the way like when you get a cut's a scar. And so I thought, oh, it's probably that. But as time goes by, I think it's more, I think there's always a little bit of that whenever, you have bronchitis or pneumonia or something, there's a little bit of those kinds of constrictions. But I really am starting to think there's a lot more circulatory issues with COVID than we all realized. And I think eventually it regulates, but like that stuff that like lingers it's a bit of a cardiovascular issue.
Right. Yeah, it feels that way. So hiss up, just continuously inhale and diffuse.
And if you feel
put it on my body, you think?
Yeah, you can put it on your body, but definitely like clean out the Ming Men, inhale the hyssop on the Ming Men, those kinds of things.
Okay.
Yeah. You're not getting any palpitations or anything like that?
Thankfully, no, not yet. No. Yeah. Okay. And then how about helichrysum?
Yeah, I like using helichrysum. I usually kind of use that a little bit more after the fact. It's not that it would do anything negative or anything now, but usually you're using so many different things right now that you don't need to add it in the mix unless you just have time and energy to do it. But definitely towards the end of the condition, I would use helichrysum.
Okay, perfect. And then so
do it is you could take a couple of drops of helichrysum.
Oh, take it internally now?
Yeah.
Okay. Yeah. All right. I got it. All right. Well, thank you so much. Appreciate it.
Chris, hi for me.
I will.
And someone's asking Minarda.
Yeah, she's on Minarda. So like I don't know if she said or not, but I knew that she was taking Minarda. So
and Greg, just continue with Inula and
like if you have Inula, that's the best thing. Like for calming down mucus, Inula breaks it up and terebinth dries it out. And so
okay, I've been doing
both. I usually use one or the other. I don't always
don't do both.
No, you can totally use them both. Yeah,
okay.
you can totally use them both.
Like 3 times a day?
You could use it even more than that.
Yeah. More? Okay. Mm-hmm. Thank you so much.
It's just inhalation, right?
Yeah, and it's just you're inhaling it a whole bunch. You could apply it to your chest or.
Oh, I thought internal. I shouldn't take it.
Okay. Yeah, you can take it internal, but most times you're getting breaking the mucus up through inhalation.
Oh, got it. Okay.
Yeah. Herbally, like that's how you would use it, is you would take a big dosage of it internally. But it's not a very common herb for treating things like that anymore. But yeah.
And terebinth,
lots of inhalations with the Inula. You can still take a drop or two internally, but lots of inhalations.
And terebinth as well, internal. Okay.
Yeah, terebinth as well, inhaling. Yeah.
Oh, inhaling and internal.
Mostly just inhaling with the terebinth.
Just inhaling. Got it. Thank you so much.
You're so welcome.
Bye-bye.
And then go ahead, Robert, then Sonia.
Hey, Robert.
Good evening, Greg. I have on the call with us my sister-in-law. She has something going on with her legs, and I wanted her to be here so you could ask her questions directly.
Okay.
And she's going to start off with something. Tracy, go ahead.
Hi, I'm Tracy.
Hey, Tracy.
So my lower legs below the calf, they always feel like there's something inside of them all the time, like and they can also be bloated or inflamed.
Okay.
And they're rarely free of this feeling, whether I'm sitting or lying down. And sometimes they radiate heat. And I get cramps in my feet in the evening sometimes. And typically my right calf will get a Charlie horse. And when it's really bad, I can see the swelling in my feet and ankles.
So when it's swollen and you like touch it, does it stay indented or does it pop right back?
No, it pops right back.
Okay, so no pitted edema.
No. And the only time I've kind of felt relief is like I had hot stones massaged on them, and that felt as though everything inside dissipated. And then that lasted for a few days.
And is there any cardiovascular issues that we're aware of?
No.
Okay. And like if somebody was to like put a little bit of pressure with their thumb on the back of your calf, would that be real tender?
No.
Okay, good. And so it feels
right now, just to check.
Okay. And it was okay. It didn't get tender or anything like that. Does it get tender or sore like when you climb stairs or anything like that?
Like I can feel it in my ankles sometimes.
Okay, but not in the calf.
No.
Okay. Does the skin ever turn color? Does it ever get red or anything like that?
No.
Okay. So you feel some heat, you feel some swelling, you get some cramping. So this is what I would do. Like I would like to just to see like right off the bat, like sometimes we kind of treat and then adjust. But are you having fluid retention anywhere else in your body or just in the lower legs?
Just in the lower legs.
Okay. So and no high blood pressure or anything like that?
No.
Okay. So the thing that I would like to do is just to like maybe use like what we call like venous tonics, which are things that help to support the veins, proper function of the veins, and getting blood from the lower limbs up, moving back towards the heart. And you know, there's a little bit of swelling, obviously, but just a little bit of what you're describing, you know, I would be concerned about like a little bit of like cellulitis, like, you know, where the area can get a bit inflamed. And it usually would be relatively painful. So given the description that you're saying, I don't know that that's there, but it's always a little bit of a potential. And so I'd say right now, let's act like it's not there. And if you know you're non-responsive to treatment, then we'll explore that a bit more. But solid choice would be to use things like cedar, like especially cedar and rosemary together, and then applied like you could put it. I can tell Robert how to make it, but basically like kind of even parts. And put it in a base of like alcohol or witch hazel, and you know shake it up really good, and then rub it on your legs, especially at night. That will be very good for supporting vein health in the legs and moving some of that fluid out of the area. I would probably also use a little bit of a diuretic, and this, if you're okay with it, I would probably do it internal. You could have some choices. Lovage is really good for something like this. Parsley oil could be very good for this. Juniper can be good too, but I like lovage a little bit more for the diuretic effect because the lovage stimulates the kidneys to like function better, where the juniper just is like a diuretic. It just makes you pee more. Like that's it. That doesn't really like kind of make the kidneys function better. Where lovage and parsley kind of do.
Great.
And,
when I saw Tracy last, I had some lovage body tonic with me, and I gave it to her to put on her legs. It didn't seem to have an effect in that manner.
I would probably want it more internal.
Okay,
like,
so like 2 to 3 drops.
4 drops a couple of times a day. Yeah.
Okay.
Yeah. Then with that, we can just stop right there. But I would say let's also add something from the health food store, which would be Goda Cola. Goda Cola. And probably 3 capsules a day, 3 capsules twice a day. Would be good. Very good for strengthening the veins, strengthening the function of the veins, helps move stuff to the head, or not to the head, to the heart, and is very clearing to the head. You know, it increases brain circulation. And so I'd like to really go deep on treating it as like a vein issue. And then if it needs more work on the kidneys, or sometimes there needs to be some like little bit of strengthening of heart function, we can do that, but this would probably still stay in place at that time. You know,
Okay.
and it's not like a forever thing. It's like once you kind of get it cleaned up, and you'll notice that like a lot of times you'll go periods of time where it doesn't really flare up, and then when it flares up, you do your little routine, you clean it up, and you go from there. And so that's where I would start with that. You know,
so
it's going to need some adjustment, but I think let's see how the body responds to this, because then you can kind of tell what's going to work and what's not going to work. And I like the thing that I always try to avoid is like, let's not be doing 15 things to try to resolve this when really we only needed 3 of them. You know what I mean? So let's like treat it for a little bit, see what happens. And so the liniment I would make quite strong. Like, you know, if you had like, I mean, you could just do it with cedar, but like if you had like a 8-ounce bottle of like witch hazel or alcohol and witch hazel, I'd dump a whole bottle of cedar in it and shake it up and like slap that on.
So 5 mil of cedar in an 8-ounce.
Yeah,
And
5,
then
even 10 mils. Like you could go pretty crazy with the cedar.
5 mil cedar, 5 mil rosemary.
Yeah, if you have it. Yeah, that would be great.
Okay.
Yeah.
And that was applied how often?
You get like daily. Like you could do more than once a day, but at least once a day on the legs. And one of the things that you could do just to augment it is put it on the legs and then lay on your back with your legs up on the wall, like at a 45-degree angle, just to help the blood and the fluid drain out. You don't have to do that, but it does help sometimes. And let's see what that does. And if for some reason it doesn't work, that tells us something, and we'll move on to something else. But yeah.
So there was that part. Then there was Lovage internal, 3 to 4 drops twice a day, and then Gotukola 3 capsules twice a day.
Yeah.
Okay. Thank you very much.
Yeah, that should be really solid for the legs. Yeah.
Thank you so much.
Yeah, you're so welcome. And if it doesn't work, don't get discouraged. There's other things to be done, but let's cross off this whole vein thing right off the
bat. One thing at a time. I like it.
Yeah.
Great. Thank you.
So you're so welcome.
Question on this vein. Can parsley be taken internally alone to promote kidney health?
Yes.
Thank you.
Yes.
And then go ahead, Shraddhananda, then Miriam.
Hi, Greg. Hi, Sam.
Hey, how are you?
Can you hear me okay? I'm on a different.
Yes.
Okay, I'm not used to talking on this one. So I have a question about myself.
Okay.
So all of the health practitioners have decided that I indeed have post-COVID long haulers, whatever the latest term is. And I'm dealing with 2 parts. One is the fatigue.
Okay.
My energy level has increased actually just a week ago, but prior to that, it was like just 2 weeks of barely functioning fatigue. And then I would have 5 to 7 days of being on par. And this has been the cycle since September. So one question is about the fatigue. And then the other thing is I thought I was having vertigo, but I started physical therapy, and the physical therapist said that actually it's orthostatic intolerance, which she's seen in a lot of people with long haulers. What happens is either just standing, if I try to stand in place, or if I go from being seated to standing, once I stand up, I feel like I'm just gonna tilt and fall forward on my face. And I usually have to either sit back down or just start walking and it'll go away. And she said she thinks it's because the blood is pooling. So it's a circulation issue.
Mm-hmm.
And sometimes I do, when I stand up, I feel like my thighs especially just feel like lead. But it doesn't stay there, it goes away.
Okay. And how long ago did you have COVID?
May 4th. But it attacked my nervous system. I had through the beginning of August, late July, early August, I had symptoms of either MS or Guillain-Barré. Like my legs would give way from under me, and my right arm, I was dropping a lot of things. And
any history of autoimmune issues?
No, not at all. I've been tested for everything.
Fatigue.
I went to neuro. They found nothing. I've had 3 MRIs. They found nothing. Been to pulmonology. They found nothing. Only place I haven't been is cardio.
So you can approach this a couple of different ways, kind of. I mean, they're in the same vein, but this is what I would do. You know, because like you said, like it doesn't always hit everybody the same way. So, you know, you have to kind of look at like, okay, there are certain things that like the long haul COVID afterwards, there's certain things that we know are kind of a constant. And then there's things that are going to be very individual, you know, from person to person, it's going to be different. And so this is what I'd like, you know, on one level, you know, I think tackling the fatigue is also associated with some circulatory issue and immunity still, you know, even though everything is been resolved as far as the virus is concerned, it's still like, you know, it trashed the hotel room while it was there. You know what I mean? Like it just ran amok. And so you could use different forms of time, like you know, time Thuanol, time Geranol, things of this nature. And I still wouldn't cross that out. But at first, I would probably go kind of hard on the cinnamon. Like I would use cinnamon or cassia or something of this nature. And there's several reasons why. And so like I want to talk it out, like why. Thyme would be a softer approach to this, but the reason that I like the cinnamon for this is cinnamon is like a full body stimulant. And when I say stimulant, it's not like taking caffeine or, you know, something like that. It's just, it stimulates body's processes. Like it just, if something is sluggish in the body, cinnamon or peppermint are 2 things that you can use to jumpstart things to make them like function better. Like herbally, you would use like cayenne pepper or African pepper, you know, something like that. And you take several dropperfuls and just keep jump starting the body, the system. And essential oils wise, it's cinnamon or peppermint. And in this case, cinnamon's a much better choice. And cinnamon Cinnamon's very good for fatigue. It's very good for reestablishing proper digestive function. But it's also a treatment for certain kinds of circulatory issues. And definitely a very strong way to enhance the immune system. And so you're getting a lot of things crossed off the list by just going straight forward with the cinnamon.
Are you thinking to digest it? Because
Yeah,
I'm
yeah.
inhaling cinnamon and hyssop all day, every day.
Yeah, I would still keep inhaling it, but I would start taking probably a couple of drops, maybe at first 2 times a day, but I'd probably work up to like maybe 4 times a day, and even increase the dosage a little bit. Like, maybe make sure your body can tolerate it, and then work up to maybe 3 or 4 drops a couple of times a day, and then after that go 3 times a day, and then even 4 times a day, until you're feeling strong even without it. And so I think you are going to have to ingest it. Like
Okay.
inhaling is helping, but it's not enough. The blood issue with the dizziness or the vertigo, or the diagnosis that you got. I mean, a lot of times with vertigo, we can usually knock that out with hyssop, and that it's not going away. That usually is, the diaphragm's tight, but more importantly, like up in the neck, the sternocleidomastoid, which are these 2 rope muscles that kind of pass over, they pass over like the carotid sinus and everything. And so when circulation is off to the head and to the brain, that's usually the culprit. But yeah, something else is going on there, and I just can't quite put my finger on it for a minute. Just give me a second here. Let me just sit with this. How is your breath? Like if you take a long, slow, deep breath and then try to exhale real slowly, like you're able to have a long, slow breath, or does the breath just empty out really quickly?
It varies. Either I can take a deep breath and exhale completely, or sometimes it does still get stuck around my sternum. But if I work with it for like up to 3 breaths, then I can breathe all the way into my belly. I've really been working on the breathing a lot.
You have a helichrysum?
Yes.
Let's have you do some helichrysum, really focusing in on the throat and the throat minor and this upper part of your chest. And you could even put a few drops on the upper part of the chest, but a lot of it's going to be inhalation, like right up in here. Okay. Like, not quite the heart area, but like, right below the collarbones, like right in there.
Mm-hmm.
I think you have like some fascial restrictions in your bronchioles. And as much as you try to treat it like spasms and things, the restrictions, they're a little bit of a different animal. And helichrysum should unwind that. Okay. I would say let's have you just do a bunch of inhalations. I don't think you need to take it internal. I think just inhalation should be enough. If you wanted to augment it, you could put a drop or 2 in water and gargle with it, and just kind of coat the throat with it more than like taking it internally. Just kind of keep coating that area. Mm-hmm. And see if that is helpful. But basically it's like like you'd get like a fascial lesion like in your back or in your leg or something that can then throw off like how a muscle functions and works. And you have the same thing but in the bronchioles, so it's throwing off how the bronchioles are working. And this is like an odd question, but do you have any thyroid issues?
No, tested clear for that.
Tested clear. And did they drop a scope down in your throat and look at it and all that?
No, just blood work.
Okay. No, that's fine. The reason that I'm asking is like sometimes when they do a procedure down in the throat, like with a scope or something, it can throw like the vocal cords into a bit of a spasm, and there can be a weird like breathing issue that starts to happen in the throat. I mean, they basically call it paradoxical vocal cord syndrome. And the vocal cords open when they're supposed to be closed and then closed when they're supposed to be open. And it presents as a respiratory issue, but you become like non-responsive to all the respiratory treatments because it's not the respiratory tract. And so, but usually almost every time I've ever seen it, there's always some sort of thyroid issue. Like it's either the thyroid's not functioning or they've been dropping scopes down into the throat to like look at the throat, and they like bump the vocal cords or something and throw that area into a kind of spasm. If things don't respond, I mean, we can still explore that, but it looks like just fascial lesions on the bronchioles to me.
Okay.
Yeah. And would make sense with having the respiratory, having COVID. Like, I mean, that kind of makes sense. And so, can you treat that for like maybe 3 days with the cinnamon and the helichrysum, and then like email us and let us know how you're doing?
Yes.
Because if it's not like making even somewhat of an improvement after 3 days, then we need to change it up a little bit. Like you should start to see something in 3 days. And if it's not happening in 3 days, then we need to change treatment.
Okay. I mean, the fascial lesions make complete sense to me. Because prior to COVID, about 6 months prior to COVID, I had a 2-month episode of RSV. Oh,
it's fascial lesions. Yeah. That cinches it up for me right there.
Yeah. It would not go away for anything, and I was coughing like severe bronchitis for 2 solid months.
Yeah. So let's see what that does, and we might give it a little bit longer, but I'd like to see where you're at in 72 hours, and just see how that's responding, and we'll go from there. So like just email and let Samantha know, and then we'll go back and forth. We're traveling, but we're just going up to Chicago, so it's not that big of a trip for us.
Okay. So intake the cinnamon, and then 30 to 50 inhalations of the helichrysum. Focusing on the throat minor,
right,
and like the higher sternum area,
right,
and apply it to the sternum area.
Okay. I would, and even a little bit of a gargle, like a drop or two on water, just kind of get it in the throat, like kind of lean back and to kind of get it down in the throat. Like, I mean, the other way of doing that is you could put a few drops in water and then just kind of slow sip it, like like you're sipping, where you're just kind of constantly coating that area like you would like with a sore throat or something. You could do that too, because it's just like the closer we can get the helichrysum to that, the helichrysum will unwind a fascial lesion like nobody's business. We just got to get it as close as we can to that area, and then let it do its thing. Okay. And if that's the case, I think that will be the ticket.
Okay. Thank you so much.
You're so welcome. Keep us posted though.
I will. Thank you. Safe travels.
Thank you.
And then go ahead, Miriam, and then we have a handful in chat too.
Hi, Greg.
Hey. How are you? How's Dave?
Good. Well, he's coughing like he's hooting. You know, he's got that
Yeah.
following up the COVID, which we had a couple
Like,
of
so
weeks.
it's been about 2.5 weeks. Is that what it's been?
Yeah, and we're both pretty good. It's just
Okay.
that
Good.
it's his default when he's
Yeah.
healing.
Yeah.
So, I mean, if you have any thoughts on that, though, that's not why I called you.
Well, coughing, and it's not producing any mucus, right? It's just like
I don't think so.
no. So this is what I do. I mean, there's some oils that we could throw at it, but remind me, does he have any history of like asthma or anything like that?
No, but ever since, gosh, for the last 50 some odd years that I've known him, around this time of year, he starts getting this bark. And sometimes it's better, sometimes it's worse, but definitely the COVID tripped it.
So it sounds like more of a chest cough rather than a throat cough.
To me, it sounds like hooting. I mean, it's not all the time, and he does very well with the eucalyptus radiata and sticking his head in steam with that. That really helps him.
Okay. Let me look something up here real quick.
See, and I don't know if there are allergies involved, because I know for myself, I can't tell the difference anymore, whether it's the cough from COVID or allergies.
When he gets like this, is there like kind of a different odor that comes out of his mouth?
I don't know.
Okay.
Do I want to know?
Well, you would usually see it more with like bronchitis, like a weird or foul odor will come out, but you know, he's having some of the symptoms, and so this is what I would probably do is do you have Naoli?
Yeah.
Like you know, it's like in the tea tree family, not neroli, Naoli, right?
Yes.
I would put like 6-8 drops in with like a little lotion or massage oil and rub it on his high chest and even up on his throat, and have him inhale it a little bit, and see if that reduces that. Did he ever have whooping cough when he was young?
No, he did not.
Huh.
Do you see? You know,
it's got a little whooping cough like vibe to me.
Yeah, that's
yeah.
what. But he does it. I mean, it's like over and over and over again every year.
Yeah. So let's try the Naoli, and then if that doesn't work, we'll send you. There's this one oil. I don't even think we have it on the site, but I'll just send you. Like you don't need very much, just like a few drops. But it's called asafoetida, and it's it's very clearing to the lung tissue itself, and there's not a lot of times you would use it. It's a strong smell, and it smells like onions. Like I mean, it is like, it's not a pleasant like this smells delicious. It smells a little weird, but he could inhale it or even take a drop or two of it internally, and it probably would only be like a couple applications. I would probably go that, you know, just because it sounds a little whooping cough-ish, you know, and like you said, like there's a difference between a cough and like when they start to get that like kind of chest like bark, you know what I mean? And that something's up there, but he's had that his whole life, huh? He said that.
And it takes him a long, long time to heal each time.
Yeah. I think we may just get you some of that asafoetida.
Yeah, I'm going to put an order in tonight. So you say it's not on the site?
Yeah, we'll get it out to you. No worries. So, okay. Yeah, let's make a note of that so we can get her.
I have a theory.
When you open it and smell it, remember that you like me, because it is a gnarly smell. Remind Dave that he likes me.
I'll tell him.
Yeah.
I have a theoretical question here.
Yeah.
Psychedelics. Okay. Plants, I don't know if I'm being redundant. This is something I don't know a whole lot about. I do understand that plant psychedelics are sweeping the psychological field and the are there any negative aspects? I mean, I'm remembering Master Choa talking about tears in the chakras with, I don't know if it's psychedelics or
yeah, anything that's a hallucinogenic, it does the hallucinogenic property is it causes tear, either causes a little tear in the protective web or causes the web to open up for a little bit and then close.
Okay, so people who are, I don't know whether to say heavy users, or does it make a difference if somebody uses it a lot?
Because of the tears and the like the potential opening of the web like that's like a kind of an uncontrolled version, is you have the potential for higher levels of elementals, which would be, on one level you could say the potential, and it doesn't happen all the time, but the potential for like basically etheric parasites is increased. And then the other issue is that dissociation, the like checking out a little bit. Mm-hmm. And when you go through and you look at the energetics of what dissociation is it's elementals that have accumulated in the arms and the legs. And so when I was doing sessions full time and people would come, because there's a little bit of a shamanic thing. I mean, that stuff's been around for a while. It's definitely gotten popular lately, but it's been around for a long time. Mm-hmm. The thing to do is you kind of clean up the webs. A lot of times just sweeping them will help, but treating the kidneys will repair webs and strengthen the webs, strengthen the function of the webs, and then clean the arms and the legs of elementals. That's like the quick way to clean them up. Mm-hmm. And so you can do that with energy healing, and then you could also do it with your best bet for that. I mean, if you had the oil and you were swinging for the fences, I would probably do it with poplar. But if you were just trying to stay on a budget and clean things up, something like Palo Santo or hyssop would work, but on the arms and the legs.
So what do you...
And there's that blend stagnation. I mean, stagnation is literally for elementals.
Oh, is it?
Mm-hmm. Another one, Litsea cubeba.
Okay.
Yeah.
So that there are a lot of workshops that are being like week-long workshops using whether it's LSD or the mushrooms or what is it, MDA or ketamine. Mm-hmm. I don't even know what these are. Ayahuasca. Mm-hmm. What is it, Daime?
What's the last one?
I think these are plants. They come out of I'm going to say
Well,
Brazil.
ketamine's a pharmaceutical, but everything else is, and LSD is a chemical.
Yes.
But everything else is like a mushroom or a plant or something. Yeah.
And so people are like, they're doing these workshops that are week-long workshops, and they're using to treat trauma. And I have some concerns. I'm not, I mean, this isn't something personal for me, but I have some concerns that might it cause permanent damage or web damage, or might it
Right.
over the long, might it not be useful in the way that
Long-term damage, the one that is potential is you look at the ones that are chemical, the LSD and the ecstasy or MDMA. A certain amount of brain exposures will start to change the brain chemistry. Usually it's, I mean, and this is old information. It's been a while since I've treated like in these realms, like hardcore clinically. But we used to look at, the average was about 15 to 18 exposures before the brain chemistry would start to change with those two substances. Other substances, it could be quite less, but those two, it's somewhere in the ballpark. It's different from individuals, but brain chemistry can begin to change a little bit. The big issue is, like, people can have, experiences, like on mushrooms and ayahuasca and things like that done in ceremony. But, I would say a lot of prayer work goes along with it. The issue that would cause the backslide would be that and the ketamine and the mushrooms can cause dissociation, which means like kind of checking out, not being able to be present with what's happening in front of you, but kind of like being engaged in a story like that's going on in the head, or like a way to manage things out in front of you. If it's a small dosage one time of like the mushrooms, that might not be the case. If there is a small little routine to go through and try to reset the fear mechanism, mushrooms can be helpful, but I would say that is helpful in cases of like severe PTSD, like really severe PTSD. Ketamine is just a painkiller that literally is a dissociative, like it causes dissociation. So people are using it therapeutically to say they're treating PTSD, but basically they're just causing the person to dissociate, and it just moves to a different part of the unconscious. And so it's good for a pain reliever. The World Health Organization still recognizes ketamine as one of the top 10 fundamental medications because it relieves pain, and like when the pain is really intense, it helps them to be able to manage the pain by not getting so fixated by the pain. But the slippery slope with things that are painkillers is that it starts to affect the psychology, and people start to use it more as a way to treat psychological pain rather than physical pain. And ketamine is not good in that realm. Like, it just causes dissociation. It will cause the issue to, like, even though the person checks out from whatever the issue is, like say they have certain thoughts going through their head, and the thoughts might stop, but it'll just reconfigure, go to some other area or some other part of the psyche and resurface later. Like it doesn't resolve it, I guess is what I'm trying to say.
Mm-hmm. Okay,
Yeah.
that was my question.
Yeah. I mean, I have seen cases where the mushrooms, it was on vets that had seen horrible things.
Right. Right.
I've seen cases like I kind of interacted with a group that they were treating the vets with microdosing of mushrooms, and I'd say for the most part in that population, I think some of it was actually helpful. They weren't on it for a very long period of time. They kind of did it for a little tiny bit and then they were off of it. But there was a couple cases that they weren't better off afterwards. They were worse off. Like, they couldn't break out of the things that they saw, and they had a hard time differentiating between that happened a while ago and this is now. Like they couldn't make the differentiation. Mm-hmm. And so, they had to medicate them in a different way. And so back in the early days, they were even doing big dosages of the mushrooms in clinical settings. And, it was all being done very quietly. And the ones that I knew that were doing it, because there was these little groups that were doing them. I pitched a fit because I was like, these guys are already unstable. You don't put them in a more unstable place. That's, the microdosing, I can see it. But the big dosage, too easy for them to have a bad trip and go to a very dark place. Like, mm-hmm. A good way to F somebody up for a long period of time. Mm-hmm. And so, they didn't take my word for it, but I think after 6 months, they kind of realized something similar to what I was saying.
Mm-hmm. Well, I think there's a big comeback now. And I think there are, there's a big sweep to develop these very complex workshops, week-long workshops.
Yeah.
And, but I don't think they're using the psychedelics alone as part of a program. And my concern is that I don't know how necessary. I don't know if there's something else they can do for some of these people who've been so traumatized. Something else chemical. I don't know. Don't know. The treatments that so many people are using with the psychedelics, they seem to work together, but is it doing damage to do the psychedelic part?
As far as like those whole like week-long things, I'm not too up on like what's been happening. I just know like when some of the vets were coming back, they were putting them on pharmaceuticals, antidepressants and things like that. And that was actually making it worse. And, in theory, I could see the microdosing a bit. Like I thought it was a case-by-case basis personally, but, smarter people were doing things about it. And, the thing with PTSD, for when there's different kinds of PTSD, and then there's other things that are psychological issues that people lump into PTSD that are not PTSD. And I think that also makes it more complicated. Like, yeah. I'm kind of dancing around something here, but when it's not like true PTSD, the potential for dissociation is much, much greater. Mm-hmm. Like that's what I would say about that. Like much, much greater. Mm-hmm. But I think that some of these things, it's like anything, like a pain reliever like Vicodin or something in a small dosage is something that could be therapeutic when somebody's in pain. In a big dosage, it's what somebody gets high on. And, I think some of these things, if the dosages could be figured out and used in a therapeutic way, I mean, it's a potential, but I don't know that the LSD would be a good choice. Like out of all of those things, like I could see potentially like the mushrooms in very small dosages, the ayahuasca in maybe very small dosages, but even then, I think it just needs to be studied more or handled by somebody who's not just an academic, but who can like really read people, you know, because you are kind of shifting a person's perception for a period of time, and if not handled properly, that shift could cause, it's like having a bad dream that you can't shake. You know what I mean? Mm-hmm. Like you wake up and you just like, you go through a day and you're just like, God, I can't shake that dream. It's like that, but for months, like months. Yeah.
There's a program on Netflix, How to Change Your Mind, and they're talking about, I don't know if you've seen it, mm-hmm. and they're talking about these different psychedelics and talking about all the research that's gone into. Yeah, I think I've got what I need from you on this.
Okay.
At least for the moment.
Think of it like this too. You always have to look at the other side of it. Is with marijuana being legalized in a lot of places, mm-hmm. other things are being explored because it's a potential revenue stream.
Mm-hmm. Well,
you know, mm-hmm. and so there's the flip side of it where there's all this talk about all that stuff now because, you know, cannabis and marijuana was a cash, you know, it was like the gold rush for you know, companies and you know, even states with all the tax revenue. And so people started looking to these things for, it's an easy sell to the public, you know. Mm-hmm. I don't know. I'm always open to like looking at something therapeutically, but for me, I always want to look at it from a clinical point of view, not just like, yeah, it kind of makes me feel better or whatever. Like I want to see clinical things like measured and not have it just shift in the unconscious. And so, you know, and I see sometimes therapeutic modalities that actually cause dissociation. And, you know, it's an easy sell. People get to check out. Like, it's like watching a movie. You know? Mm-hmm. So, you know, I hope that helps. Maybe we can talk more about it when I see when.
I'm looking forward to seeing.
Yeah, me too.
Yeah. See you in a couple of weeks.
Yeah.
Okay, thank you.
You're so.
Go ahead, Sahaja.
Hey, Sahajananda.
Okay. Hi there again.
Hey.
Wow, that's a fascinating discussion. Thank you for that. Having grown up in the age of psychedelics.
Right.
Yeah. When you were talking to Shraddhananda about the fascial lesions in her bronchioles and stuff, I personally, I have a spot that's sort of like where I think it's pretty much where my diaphragm and my ribs connect.
Okay.
It's a spot that has been hurting when I lie down on my back. It's been hurting for like 20 years.
Right side or left side?
My left side. And it's like halfway between my spine and the outside of my torso. And it's sort of right inside. It's not, you know, on the surface. And I'm just wondering if, you know, there's probably fascial lesions there to try and break that up using helichrysum for that?
For that, I would like, because it feels a little bit more like skeletal muscle, or like in the skeletal muscle, smooth muscle area.
It's so hard for me to say. All I know is that when I lie down and my muscles start to soften, that's when it starts to hurt. It's almost like my muscles tighten around it, and it doesn't hurt. And then when I lie down on my back, it's like this, some pretty acute pain, which I try to just soften around so that I can actually keep lying on my back. It's mostly during my yoga practice. And it's been diagnosed in different ways, like that the tendon was falling off the rib or pulling off the rib. And then recently somebody said it's probably, there's a psychological component, but that it's the fascia has created such a tight web around it, and that's why I thought of when you talk.
Close to the ribs though, or is it deeper?
It's oh man, see, it's like right inside. It's like it could be close to the ribs, but deeper. I'm not describing.
Okay, no, I get you. So does it hurt when you inhale? Like when you're laying down and it starts to flare up and you take a big, long, slow, deep breath, does it hurt?
It can hurt when I inhale, but it hurts if I just move, at that point.
And it's a sharp pain?
Yeah, it's pretty sharp.
That sounds like intercostal neuralgia. Like you can get it from all kinds of things. Like sometimes it can be because like a rib is maybe just slightly out of place, but it could happen like with a coughing spat or exertion, lifting something, excessive heavy breathing, like an exercise or something like that. And those little nerves can get irritated, and then it easily could just not go away. Like it's like having like a stiff shoulder, but between the ribs. Mm-hmm. And so that you're having pain, like you said, when you're laying down and relaxing and the muscles start to soften up, that's changing the dynamic of the rib cage, and that you have a little bit of pain with the inhalation. Those are usually indicators for intercostal neuralgia, and that even somebody diagnosed it that the tendon, is something with the rib cage. Again, that tells me it's like kind of in that same little area. I would treat it with, I would rotate a couple of things. Like I'm just going to like think this out with you, right? So like three things that I would say is one, you want to calm down the nerve, right? The sensory nerve, and so things like vetiver or sage can be helpful in that. It's not going to make it go away, but it would calm it down. I would actually even look at there's that blend nerve help. It's very good for calming down the nerve and re-educating the nerve. So I would use like, probably even put it on meat in the area, like just, cover a bigger area than what's right there. But like if these are the ribs like this, you're kind of almost want to take your finger and stroke in between the ribs in that area just a little bit, not hard. Like you're just kind of, because feel almost like sometimes like you can feel like the inflamed nerve endings. They almost feel like little like BBs or something that will kind of move around. And it's an inflammation that's in there that you can feel them or not, it doesn't matter. But so I would use that, and then I would use something to move the lymph, so bay laurel, lymphatic blend, chakra root cleanser, anything that just moves some lymph in there, just like kind of detox it a little bit. And then I would use, and these all don't have to be in the same session. You can just rotate them like through the day, through the week. And then something specific for calming down the nerve pain itself, knocking out the nerve inflammation, the nerve pain. So that pain relief, neuropathic, peppermint, corn mint, anything minty is always kind of good for nerve pain. Yeah, like I'd probably stick in that realm, like pain relief, neuropathic, or like peppermint, corn mint, spearmint, something like that.
And just putting these on.
Yeah, you could put that on with a little lotion, or even that if you can handle it. I put just a few drops in topically in a neat application, and then rub it in the area, and then just keep rotating between all of those. I mean, at some point, I'd probably work in something for like spasms in that area. Yeah, I say spasms, but I think we're probably leaning more towards like a contracture. So I go back to like that nerve help would probably help that. Vetiver by itself, like that unwind blend. We had that in
yeah, I have it.
Yeah, you could rub some of that on there. Even like spikenard and valerian are really good for muscle imbalances and for contractures. And contracture is different than a spasm. Contracture is there's no neurological reason why the spasm is there. So that being said, it's usually because something's out of place, there's a misalignment, there's a rotation, there was excessive stress on that particular area. So here with the rib cage, there could have been at some point excessive respiration, like breathing really hard, and went into a spasm and just never went out of it. And those things can go on forever. Like they just, they don't know, like it's been a week, I should probably unwind, and so it's antispasmodic, but it's not so much that it's antispasmodic, it's more about that it reduces the contracture. And sometimes with the rib cage like that, those contractures can be an issue. Like the thoracic cage, the rib cage, the tendency is we get little spots on the I keep saying thoracic cage, sorry, the rib cage. We'll get like little spots that they get, like you said, like those fascial lesions, where you'll have full expansion except in this spot, or except in the spot over here, or except a spot in the back, and so it expands except in those areas. So then it starts to limit the chest expansion, and so go through and just even treat some of the rib cage like that actually can be very, very helpful. On athletes, I used to do a thing where when we weren't having an issues like this, is I would use very soft forms of thyme, like thyme linalool, thyme thiolinol, and we'd do a thing where we'd cover the rib cage, especially the front and the sides. The back, you're starting to have to go through back muscles. But to increase the circulation in those muscles between the ribs, just so that they are able to function better, like they're able to expand more and contract more. Because it's like, if you think about like, you favor a hip or something, and all of a sudden there's a contraction, you're not getting the full extension or the full contraction to move that joint, and then pretty soon those muscles just kind of like harden, like they're still muscle, but they really start to lose their movement, and in that they'll start to be painful. And so, you see that the body does this to like prevent injury in like a joint or something like this. It can definitely do that in ribs. Like, the nerve got irritated, it tightened up, and they almost like start to function like bones, where you're just supporting body weight, you're supporting like structure, you're protecting a particular part of the body, but there's not quite the movement there. And so I would say let's clean that up so that the pain reduces, and then even do like a kind of treatment where we open up the rib cage for you a little bit.
Mhm.
Yeah.
Okay.
We were just actually talking about last night we were talking about like classes coming up, and I was like, how we've done the regeneration for the immune system and things like that. It's like we need to do that for the respiratory system with all the COVID stuff, where we just go through and just break down all the pieces of the respiratory tract and the rib cage and all of that, and just have like a therapy weekend where we unwind that. And so that would be in the vein of that, where you're trying to open up those muscles of those rib cage of they're called the intercostals. You're trying to open up the intercostals, and nobody ever thinks about them. Like there's these little tiny muscles that are always active because of your inhalation, exhalation, and when they stop functioning right or start to have pain, man, I've been there. Oh man, I had an injury when I was young one time, and every breath hurt, every breath. And going through and then winding some of those muscles can not just reduce some of the pain and irritation, but it can improve your inhalation, exhalation. It can improve your breathing. And so let's have you try what we talked about first, and then if that doesn't resolve it, then we'll try something different. But after that, we'll go through and do a thing about opening up your rib cage.
Okay.
Like the whole rib cage. Let's just top to bottom.
Okay.
Yeah.
Great.
Yeah, it feels good. Like I do it on myself from like maybe once a year or something.
Mhm.
But when I was younger, I used to do it a lot. But now, about once a year.
Okay. Well, thank you very much.
Yeah, you're so welcome. Keep us posted. Like try that, and then if you need some substitutes or something, let us know. But like try that, and then if it's not resolving it, then we'll try a little bit of a different approach. But
Okay.
That should start to do something there.
That would be great. After 20 years, that would be wonderful. Okay, thanks so much.
You're so welcome.
And I have this one in chat, then give me a sec, Megan, we'll get to you after this one here. My friend is in her late 70s to 80s. She desperately wants to be able to sleep and stay asleep. Right now, she sleeps 2 to 3 hours at best. Sometimes she doesn't sleep at all, despite being thoroughly exhausted. Sometimes she wakes up and is unable to return to sleep. The problem started after her husband moved to a nursing care home in July, and she spends hours every day providing the care she suspects the home is not providing. What keeps her awake, including anxiety about her husband and his situation, exhaustion, agitation, grief, an endless list of responsibilities. She eats poorly due to lack of time and energy to prepare food. She is on medications, likely including a blood thinner. She says that physical pain is not a factor in her sleep problems. There is not a lot of issues to address, but right now she just wants to be able to sleep. Could you please recommend something simple, easy, and quick, not only to help her sleep, but also to fortify her during the day? Perhaps she could do multiple times during the day if she finds the time.
Yeah. Hmm. I mean, it's because it's a complicated situation. Like it's not just like can't sleep, but there's so much going on there. So what I would probably do, I mean, this is one of those things where you're going to have to like, we'll have to treat and then see how she responds. Um, I would actually have her both inhale and take internally kava kava in the evening. She doesn't really need to do it during the day, but as she starts to unwind and I mean, this is one of those cases where sometimes I would actually use very small amounts of saffron essential oil, like probably a drop internally, just because it's not that she's just having a hard time falling asleep. I mean, obviously, based on what you're saying, but it's she's having to focus so much on these situations that are, you know, kind of important and a lot riding on it, you know, quality of her husband's, you know, health and life and you know making sure that he's okay and all these kinds of things. And you could say that like the saffron hopes to pull you out of that state and helps to kind of shift into a more like intuitive side of the brain, which is starting to be close to what happens when you're going to sleep and in dream time. And the kava might just calm her down, but I suspect that we might need to do a little dose of saffron. And so we can do a very like small amount rather than have you get a whole big bottle and see if it works for her. You know, like we could just do like a mill or 2 mils or something and see if that works. And then if it works, then you can use it in the treatment. But if it works, she might not even need to do it every day. You know, it could be one of those things where she does it, but you know, if I'm super like been pushing, you know, because like sometimes it's not even just stressful. It's just like you've been pushing and pushing and pushing and super focused. And then it's like all of a sudden, okay, now hurry up and relax. Like, okay, it's time to let go, hurry up and relax. And it just takes you a while to stop that momentum and then like decompress. And the saffron makes you like decompress like that. Like it just shifts you into that decompression mode. And so, you know, we haven't talked a lot about different therapeutic uses for saffron, but this might be one of them. Yeah. And so we can interact with that. I mean, you can just try the kava kava off the bat. That's an easy one to do, and maybe that will work. But if that doesn't work, then I'd say let's probably try the saffron.
Just to clarify, the kava, how many drops? The saffron?
2 to 3 drops internally. Like I'd say 3 drops of the kava, and then she can inhale it, you know, 20 or 30 times, you know, or more. You know, she can inhale it until she relaxes. Yeah.
And then
if we do the saffron, it would just be like a drop. You know?
Okay.
Yeah, one drop. And so
okay.
You know, so if we did 1 mil for you, like a 1 mil should be about like 18 to 20 drops probably. So, you know, you could get several dosages out of that without having to buy like a big bottle just to make sure that it works or something. So, you know, whatever we can do to help accommodate Nick. Sounds like she's having a tough time. So, you know.
Thanks. Go ahead, Megan, and then we do have more in the chat, but we only have 4 minutes. So.
We can follow over into the other. Yeah. Hey.
I want to ask, you ever open a healing school, Greg, like a physical? Will you open a healing school, a physical healing school? You can go and get your textbooks and take classes and get a degree.
It's kind of not a bad idea, but
Be all legitimate and everything.
right. Because like it's kind of interesting because like I interact in different circles, and like how we talk about oils or therapy or something is different depending on the circle that we're in. And when I talk to people who do like physical manipulation or whatever, we have a whole different set of conversations. But then, we get in with psychologists or something and different set, and then spiritual practitioners and things, it's a whole different kind of conversation. And so, and sometimes we're not even talking about oils. Like, sometimes it's other modalities and things, but.
Yeah, like on the, the revenue stream comment, like, one of the things that keeps me up at night is just the corporate pharmaceutical insurance, whatever you want to call it. Industrial complex. Is that, should I give up with that changing in my lifetime? Like, just let it go, forget about it. Is it just going to be 100 years out before that kind of like house of cards falls in on itself?
Yeah, it's hard to say. Hard to say.
Give me something to look forward to, or don't.
Yeah, like I think that's the difficult thing is like sometimes so much of our healthcare is dependent, like even doctors making choices is dependent on insurance.
Yeah,
and so they're very limited, and so. When I was seeing my doctor, I was like, let's set insurance aside. Let's like, if I was to like, pay for some things out of pocket, like what could we do? And he was like, oh, like he got so excited. He was like, we could test you for this, we could test you for that. He goes, normally I have to justify doing it, but if you just won't pay for it, we could go and test all these different things. And it's a tough one. Like doctors almost don't get to be doctors sometimes. It's just the nature of the situation. But it would be nice if they could problem solve in a way that was different than what happens now.
Yeah. Well, I'm still waiting on those books. I believe one was promised over the summer. I didn't get an email.
Yeah, it's you didn't get an email. It's being worked on. It keeps getting bigger and bigger.
How about a teaser, just a chapter, give us a chapter.
Yeah, it might be coming here pretty soon.
Okay, thanks, Greg.
Yeah.
For that other person, real quick, before we jump over to the angel practice, anything to fortify them during the day? Remember the sleep, we focused on the sleep.
Fortifying during the day. Again, this is like odd because it's not quite exactly what you're asking, but I would give them ginger during the day. And the reason being, helps a bunch of body functions, helps to reduce inflammation, but it also helps with hitting the anabolic state at night when you're sleeping, which is when the immune system, the nervous system, the endocrine system, and the muscles all kind of reset, like they regenerate or reset. And when somebody's under that kind of stress, they're usually not hitting that state. And so it's not going to increase the energy like massively, but it will make them feel a little bit better and improve digestion and reduce inflammation in the body and fortify the brain and things like this. And so that should be helpful.
Inhale or internal?
I would probably still take that internal, like a couple of drops internally. Yeah.
All right, guys.
We'll continue with these questions, but we'll just jump into the esoteric group and still continue with these so we get all your questions answered.